Welcome back. It's time for Health Reports, and joining us now is Africa 54 Health correspondent Linord Moudou with new information on the Zika virus. Hello, Linord.
Hello, Vincent. The director of the U.S. Centers for Disease Control and Prevention says that by the end of the year, the number of Zika virus infections could rise to be hundreds of thousands. The World Health Organization declared the Zika outbreak suspected of causing thousands of birth defects in Brazil, an international health emergency on February 1st. But much about the virus remains unknown. In testimony to the U.S. House Energy and Commerce Committee, Dr. Thomas Frieden says Puerto Rico may be particularly hard hit. He also says the CDC was examining the rapid rate of infection in Puerto Rico of Chikungunya, another mosquito-borne viral illness which widely affected the island in 2014. Zika shares some of the same pathogenistic characteristic as chikungunya. Both diseases are transmitted by the Aedes aegypti mosquito.
There's a limited window of opportunity to take action. When we look at chikungunya, which affected Puerto Rico started in 2014, within 2 months, it was all over the island. Within 8 months, 1 out of 4 adults were infected. If that pattern is followed with Zika, we could see hundreds of thousands of infections by the end of the year.
Now, the issue that we're really concentrating much of our effort on is the issue of vaccines. And we now do have a couple of candidates that we're looking at putting into a phase 1 trial, hopefully by the end of this summer and early fall, which will take a couple of months to determine if, in fact, they're safe, and do they induce an immune response that will allow us to go to the next phase of the response, which is an efficacy phase.
Now, tech companies are stepping up to help in the fight against Zika. Google just announced that it is providing a grant of $1 million to the United Nations Children's Emergency Fund to analyze data in an effort to map and anticipate the spread of the Zika virus. Another tech company, Sickweather, has now launched a Sickweather Groups, an open messaging platform for anonymously reporting and monitoring disease outbreaks such as Zika or Ebola. And joining us for more on the subject is Graham Dodge, CEO of Sickweather. Mr. Dodge, welcome to Africa 54.
Thank you for having me.
So we know that when it comes to disease outbreaks such as Zika and Ebola, surveillance is key. Accurate data is key indeed in terms of monitoring and addressing the issue. Can you tell us about this and why it's important for you to get involved?
Sure. Well, because early detection allows you to have prevention. So the sooner you know about an illness outbreak or an emerging infectious disease, the sooner people can respond and the medical professionals in the community can respond.
Now tell us about this app that you came up with, which is on your website, sickweather.com.
Yes, Sickweather is a free mobile app that anyone can download for iPhone and Android that will tell you in real time where and when illnesses are going around. So it uses social media essentially for people, listening for people talking about symptoms of illnesses, aggregates all that data in real time, and lets you know when you enter a sick zone for norovirus or flu. And we are, in fact, working on surveillance for Zika as well.
So new technologies today are like almost in every aspect of our lives nowadays. What are the advantages of an app when it comes to disease surveillance that we didn't have before?
Well, there was no real-time source of data before that allowed this kind of early detection. And with the advent of social media, you basically have a real-time census of people sharing their symptoms and illnesses. If you can filter that correctly the way we have with Sickweather, you now have this real-time insight into how illnesses are spreading. And that's exactly what Sickweather does.
So how does this work, really? Anybody can report?
Correct. So we gather data in 2 ways. One is through listening to social media, sites like Facebook and Twitter, for public posts of people sharing symptoms like my kid has the flu or I have strep or things like that. Or you can download the free app and report directly to Sickweather which illnesses you're experiencing. And with Sickweather Groups, you can now share that directly with a location such as a school, a workplace, a hospital, which are really sort of these vectors of illnesses in and of themselves.
Now, where we stand, looking at where we stand with the Zika outbreak, how is Sickweather going to contribute, especially with the Olympics coming soon in Brazil?
Correct. So the first stage for us is to allow people to openly report any illness, whether it's Zika, Ebola, anything that we may not be tracking yet in terms of providing that surveillance on a map. But our goal is to get that surveillance in place in time for the Olympics in Rio this summer.
What other features do you have?
So with the Sickweather app, you can be notified in real time with a 6-zone alert when you enter a 6 zone. You can also get your 6 score, which is like a contagious threat level index, letting you know how much risk there is of contagious illness in your immediate area, and that score changes as you move about the city.
And so then if you are able to know if you are in an area where there is a disease, can this be a concern if somebody being worried, maybe a little too worried?
Well, sure. Yes, there is that element to it, but mostly the testimonials we're receiving are from moms, with young kids who thank us because, now that they know strep is going around in their neighborhood, they get their kid tested for strep. And in one case that we were told about, he tested positive for strep just at the first sign of a fever. So she was able to get her son on antibiotics sooner so that he wasn't contagious and he'd go back to school and she could go back to work. So there's a sort of a pre-diagnosis and preventative, just general proactive measures that people can now take that were never available before.
Okay, and let me mention that it's available on iPhone and all the other app store out there. Thank you so much, Mr. Dodge Graham.
Thank you, Linord.
And Graham Dodge is CEO of Sickweather. That's our Africa Health Report for today. Vincent?
Well, Linord, thanks. And be sure to watch Linord Moudou's Health Report every Tuesday and Thursday right here on Africa 54.